You're listening to the Westminster Canterbury Tales Podcast, creating community to foster joy and well-being. Thanks for listening.
Good afternoon. This is Tori Crenshaw, the Senior VP of Health and Innovation here at Westminster Canterbury on Chesapeake Bay. And I'm delighted to talk to you a little bit today with my friends Beth and Zella Byrd, both from Align Senior Care, and talk a little bit about our journey with Align Senior Care. And I started this journey with team members here at Westminster Canterbury and others, and with Align many years ago. Actually, it's probably been at least 4 years ago, when we wanted to have a Medicare Advantage program that would be offered to our healthcare residents here at Westminster Canterbury. So with that, we have grown a lot. Great things are happening, and I wanted Beth and Zella Byrd to introduce themselves and to tell us what is Align Senior Care. Who wants to take that on?
I'll do it.
Okay.
I'm Zella Byrd. I'm the Regional Sales Director for the Align Senior Care Plan, and I have the lovely Beth with me today.
Hi, I'm Beth. I'm the Care Ally with Align Senior Care, and the best way to describe a Care Ally is case manager. That's my role.
So what is the Medicare Advantage program? How does it work for our residents here?
With the Align Senior Care, it is a Medicare Advantage health plan, and it is insurance for the residents. And the thing that I love about the plan is it's designed to work specifically here at Westminster. And our plan is unique for the needs of your residents. We help your Medicare benefits work better for you, giving you more benefits when it matters the most.
So when we first sat down and talked to Align Senior Care about offering this for our healthcare residents, I was so impressed about the additional or different healthcare benefits that if you're with a Medicare alternative plan can be offered. And definitely the ones that you offer our residents here have been quite a hit, including getting $25 a month for groceries for qualifying conditions, and the eye exams and foot care and preventative care is just so impressive. Our residents have been so excited about getting some of these services that they would normally not be able to get under their traditional Medicare plans. So what kind of feedback have we been hearing from residents about this?
Well, the residents really seem to enjoy having the personalized visits that we provide. There's a nurse practitioner that works with the primary care provider to visit the residents right in their apartments, so it's convenient. And then we do have those enhanced services that we offer, like a certain monetary amount that can be applied for hearing aids, and we cover podiatry visits and dental care. And particularly with the dental care, we have a dentist that comes right to Westminster Canterbury in our network, so it's extremely convenient. And then with my role as the Care Ally, I can help even place orders for grocery and over-the-counter items to use those benefits right there in the resident's apartment, so they don't even have to go out to access those benefits.
So this program is available to our assisted living residents who might qualify, and also our long-term care residents and our Hoy Nursing Center. So as we help to educate across our entire campus, we want individuals to know the program is specific for those populations.
Right.
So how does it work? So the plan covers your original Medicare benefits. Like, tell me about Part A, hospital insurance.
Right. So the plan replaces your existing insurance. So it is your hospital insurance, and then it's also your medical insurance and your prescription insurance all wrapped into one.
That's great. So how about, you talked a little bit about this over-the-counter kind of catalog. What kind of things are available to individuals that might want to go online or to go down to our Starfish Pharmacy and see what items might be beneficial?
Yes, so with the over-the-counter allowance, it covers incontinence supplies, and then also regular health supplies like toothbrushes and toothpaste, shampoo, lotion. And then the online catalog, or you can place orders by phone. But I like the online catalog because I can look through it with the members when I'm visiting. And there are items in there that you wouldn't expect, like safety benches for the shower, canes, bed canes that can be attached to the bed, toilet safety bars, all kinds of safety items, braces, supports for wrists and ankles. It even has reading glasses.
That's great. And the other benefit that really stands out to our residents is the fact that they do not need a 3-night qualifying stay in an acute care hospital to qualify, if needed, skilled nursing services. So now most individuals with the Medicare plan, if they go to the hospital, they have to have a 3-night stay before they qualify to have Medicare benefits utilized in a skilled nursing center. And many times with the hospital moving people in and out so quickly, that 3-night hospital stay is sometimes difficult to obtain, especially if people are in observation days and not really, quote, admitted to the acute care setting. But for this plan, that's not necessary if a person meets the needs of the skilled requirement. Can you talk a little bit more about that?
Yes, that is just such an important benefit for our members because we want to decrease the amount of time that they're away from their home. And so if we can eliminate the need for that hospital stay, that's what we want to do to improve quality of life and help them get what they need and have it right here at Westminster Canterbury. So we also have a skill in place benefit where if we identify that someone has a skilled need at Westminster Canterbury, they can be transferred right to the skilled unit and get that care without even having to go to the hospital.
What's really also nice is that in the Hoy Nursing Center, all of the beds are, quote, Medicare certified. So an individual who might need the services, skilled services, qualify for those, could come back to their room in the Hoy and get those services in their comfort of their own room. With that also, I know that we talked a little bit about these additional benefits, but I'm real curious about vision and podiatry. Those are the key areas where older adults might need some attention.
So with vision, members get an annual eye exam. They have a $150 allowance for their frames and lenses or contacts at any of our in-network suppliers. And then with podiatry, they get 4 routine foot visits every year, including any corn or callus removal, nail clippings, and regular preventative maintenance for their foot care.
All those things that are so important to keep you healthy.
Yes.
In addition to hearing aids.
Yes, the hearing aid benefit is huge. It's something that a lot of our members choose to take advantage of. We give up to $1,000 for hearing aids every year. We even have access to a hearing aid provider that will come to Westminster Canterbury to do the assessment, evaluation, and order the hearing aids with a member never even having to leave their home.
That's terrific. So tell me a little bit about, just in general, what you're hearing from family members in terms of, I know that there's some concerns like, I don't want to give up my traditional Medicare, I can never get it back, and what if I don't like the change I've made? So maybe we could speak to that.
Absolutely. So with the Medicare Advantage plan, when you were in an assisted living or long-term care facility, you do have the ability to change your plan every month if you chose to. So the good thing about the way that our plan works, if someone comes on the plan and they find that it's not the best fit for them, they can convert back to either original Medicare with a prescription drug plan, or they can switch to another Medicare Advantage plan. The one thing that we do as agents, my agents that come in, they do a full evaluation to make sure that the plan will work good for them with their doctors, their prescriptions, and to make sure that it doesn't affect anything negatively if they've got an employer plan previously, something like that. So they do a full evaluation.
So I see there's an extra help program. Tell me more about that.
So with Extra Help, that is a federal program that is designed to help people with prescription drug premiums and copays. With the Medicare Advantage plan, that's incorporated in the plan. So if you have the Extra Help, it will pay your premium. There's no premium on the plan whatsoever. And then depending on the level you qualify for, it can reduce your copays all the way down to $0 for your prescriptions. That is income-based, and it does have several levels. It's not like Medicaid, where you have to have a super low income to meet any qualifications. So it does give broader coverage for people that need that assistance.
I know y'all are very passionate about this. You've come over to our site. You meet with families and you meet with the residents to talk more about the benefits, and you compare their current program. Tell me a little bit about what that looks like.
What we do is when someone is interested in our plan and we meet with them, we'll get their Medicare number, and we can pull through a system that Medicare provides for agents where we can see their current plan information. So most of the time the agent will research a little bit that themselves and then talk to either the responsible party or the resident, depending on the situation, to find out, is it a plan that is tied to an employer pension? Is it a plan that is something that they cannot get back into if they come off of it? So they'll look at the benefits that are provided under that plan, compare it to the benefits on our plan, and then speak to the families or the residents and explain the differences between the two as far as this is what ours can offer versus the other. The one thing I love about our plan is everybody comes in, like Beth was speaking to. So you've got that care coming directly to your loved one. And with our model of care, where we have the care ally that comes in, that's an extra set of eyes to look at those residents. A lot of times they can catch things that are going on that are affecting the residents' health and help prevent those hospital stays. So it all works together beautifully. A lot of your regular Medicare Advantage plans don't offer those things. They are strictly medical and drug coverage. They don't have a care ally associated. They don't have the people coming into the facility. So those residents do have to travel to see the doctors. Those are the main things that I feel set us apart from the other plans. But my agent will never do anything that is going to negatively impact a new member. So that's why we do that full evaluation of the doctors that they're seeing, the drugs, and what their true care needs are.
So if you could elaborate a little bit, because I sparked my interest when you talked about physicians and all the extra things that are provided. How do you and these care coordinators or partner with the individual's physician in communication and in managing the care?
Beth, I'll let you speak to that.
Sure. So a particular scenario comes to mind where I was making rounds with our nurse practitioner not too long ago, and a resident expressed that she was having some heart palpitations. And evidently, she hadn't shared that with anyone yet. For some reason, she shared it with our nurse practitioner. And so we immediately got in touch with the primary care provider. Long story short, we ended up with a cardiology appointment and some medication adjustments. And we were able to capture something before it ended up becoming a problem. And so I like to think of the nurse practitioner and I as being a complement to the care team here at the community, just to help make sure everyone's getting what they need.
That sounds great. And I know our real focus is avoidable hospitalizations. And that is real huge, because the last thing you want is an individual laying on a gurney in the ER waiting for evaluation when they don't really need to be there, and we could manage their care here. So give me an example of what kind of interventions you might have to manage someone's care here so that they're not going to the hospital if they don't need to go to the hospital.
Right. So the nurse practitioner visits regularly and conducts assessments. So she's asking the residents about their pain, and she's listening to their chest and their heart rate, and we have access to the medical record, so she's aware of any appointment specialists that the person sees, so that we can stay on top of what their health status is and what their care plan is. And then as those needs arise, we know who to contact. So we'll be in touch with unit coordinators or the PCP or, whatever is appropriate to help facilitate items that need to be followed up on.
And the other thing that I've noticed is the amount of therapy that is provided to the residents that could help them get stronger, can really address risk of falls and some of these other things that then would possibly have someone going to the hospital. Can you talk a little bit about how you partner with the rehabilitation team to ensure that residents are getting those services, getting a little stronger and really looking at that?
Yes, so we do communicate with the rehab team and try to get the authorizations approved as quickly as possible to have PTOT and speech therapy as needed for our members to make sure they're getting all of those treatments as much as they need them.
So is there anything else you want to share about the plan that I have not asked or that you are very proud of that we haven't reviewed today?
I think the one thing I would like to share is the feedback I get from members and from their families, where they say having a care ally is like having your own personal representative from the insurance company, which no one's ever heard of before.
If they even answer the phone, right?
Right. So they'll get, a family could get a bill in the mail and they will take a picture of it and send it to me and say, do we really owe this? Can you just check on this and make sure that Align Senior Care was billed and that that's actually is our portion to pay before we pay it? So instead of having to call a 1-800 number, they can call me. And so that is a huge benefit, I think, to the residents and their families.
Yeah, absolutely.
I can't speak enough about the nurse practitioner and Beth, the care ally, what they bring to the table for these residents. We all have a heart to see everyone live longer, stronger lives. And what they do and the care that they truly have, they have the heart for our seniors. And we love that. We love that. They're a joy to work with, and the benefit that comes through that plan of having those two wonderful ladies is fantastic.
I know as I review the information on a monthly basis, I'm really struck by the fact when I look at the therapy that's provided, and if you're in a traditional plan, there's limits. But if therapy is really needed to improve the quality of life for that individual and to help maintain them at this level of care and not deteriorate, y'all are providing that through our rehab company. So that's really something that is just awesome to be an advocate for the resident like that.
And our statistics for the plan, it shows the reduced hospitalizations. Because let's face it, whenever you get out of the routine and you have to make a hospital stay, can be unsettling. And the more that we can keep them healthy and happy where they are, it helps with emotional, mental, and physical. So I just feel strongly about what we bring to the table. And when we were speaking about other carriers and other plans, it's a unique model that Align Senior Care has. I don't know of any other company in the industry that truly offers those services for residents. So that's why I'm very, very passionate about what we do. It's got great value.
I know when we were really looking at who we wanted to partner with, and we did a lot of research on that, your organization really stood apart in terms of the quality and the focus on the patient. So I thank you for that. And how can somebody find out more information? They're listening in, their resident, let's say, is transitioning from assisted living to the Hoy Nursing Center or from independent living to assisted living, and they say, wow, I want to hear more about this.
Absolutely. Well, they can always speak to one of you, and you can give us their information to contact. Or I do have a wonderful agent, Vernon Garrett, and his phone number is 804-206-9616, or you can email him at vernon.garrett@curanahealth.com. Curana is CURANAHEALTH, Curana Health. But he is also in the centers at different times, so there's a lot of different ways. If you just throw up your hand, if you want to talk to Beth, Beth can also help refer you over to the agent, and we'll get you taken care of.
We do have a team of champions right here on campus that can help connect you. So definitely the administrator of the Hoy Nursing Center, the administrator of our assisted living, our therapeutic rec team, our finance department. I mean, there's so many places that you can come and ask the question, and they'll know exactly how to get in touch with the right people to connect you and hear more about this plan. So, ladies, thank you so much for coming here today. This has been a great discussion of a great product, and we want more people to get excited about it and join the program.
Yeah, and if there's any questions, we can answer at any time. If you just want to dig a little deeper, feel free to reach out and let us know. We're not pushy salesmen. We're there to truly find out if it's going to work for you. And we look forward to speaking with you.
Thank you.
We hope you enjoyed this episode of the Westminster Canterbury Tales Podcast. Thank you for listening.